According to the Ministry of Health, cancer screening should be done at least once in a year. Today, MKTV channel visited the Hamptons Hospital, which is an advanced cancer treatment center located in Kakamega County. And during our visit, we interacted with Dr. Siminyu, and here is the story.
I'm Patricia Nalienya, Community Health and Social Worker at Hamptons Hospital. Hamptons Hospital is in Kakamega County, Butere Sub-County, at a place called Lunza. So today we have Daktari here who is going to give us more insight about this institution and what we offer and what we are doing so far. Karibu Daktari.
Thank you very much, Patricia. Hamptons Hospital is part of Mwale Medical and Technology City. It is actually the heart of Mwale Medical and Technology City. The city comprises of various components, but today we are just going to focus on Hamptons Hospital. The construction of Hamptons Hospital started in 2014 when the groundbreaking ceremony was done. However, the construction has gone on until 2019. That's when we started the outpatient department, and that's when we actually started our operations. This is a licensed facility by the Medical Practitioners and Dentists Board. We are part of the private hospital system that is operating in Kenya, and I must say that one of the things we have been following up was accreditation by NHIF. This we received about 3 months ago, and following the accreditation of Hamptons Hospital by NHIF, I want to tell the audience that we are open to all cadres of patients. There are those whom I have overheard saying that this is a hospital for the elite or the rich. This is not a hospital for the elite or the rich. It is the hospital for all of us. When we started with the two departments, that is outpatient and cancer treatment. However, we eventually opened up and started the radiology unit, which comprised of X-ray and CT, and then we also opened up a laboratory where we do all sorts of tests. We are partnering with Lancet for those tests that we are not able to perform in this particular hospital, and then we also opened up a pharmacy. Lately, with the introduction of NHIF, we have now started inpatient services, and as you can see, we are actually in the process of expanding our services. Two things have hindered our operations for us to be able to open up, and one was that the power supply was low. We were just operating with the 1 mega unit to power all our equipment, and therefore we could not bring in some big machines. However, under Mwale Medical and Technology City, we have managed to start a solar power plant, which is going to beef up our power supply to 10 mega units. Now, once we get to 10 mega units, then we shall be able to power more machines, meaning that we shall be able to bring in more expensive machines which require more power, and I'm referring mainly to the MRI, the PET scans. So once those ones are available, then we shall be able to enhance our diagnostic ability. Secondly, we have been creating space for other departments. Ultimately, we intend to have all departments within a certified hospital. That is, we shall have a maternity unit, we shall have a renal dialysis unit, surgical unit, and all the departments that normally are in any particular hospital. We are also engaging experts from other areas because it's a technology city, so we are actually going to engage experts who are going to be attending to patients online and also virtually. We hope that as we open up the IT department, we shall be able to reach out to more patients through technology. We are also opening up various departments, and more so, like me, I am actually a surgeon by profession, and therefore I will really be looking forward to opening up a theatre, and this theatre definitely we shall be able to engage other consultants who are able to come and join us in performing several procedures. I want to confirm to the public that our hospital is not competing government hospitals. Our hospital is offering complementary services to government hospitals. So patients have a choice to go to a government hospital, and they also have a choice to come to Hamptons Hospital. Our outpatient charges are on first visit, it's 1,000 Kenya shillings, and on subsequent visits, it is 500 shillings consultation. However, when we do certain tests and certain x-rays, then we shall ask for additional fees because of the laboratory services or the x-ray services that we shall be offering in addition to the consultation fee. So let people not be scared of coming because they think our services are costly. Our services are not costly. They are just the same as all the other services that are offered in any government hospital. I would also like to urge Kakamega residents that it is the wish of the directors of this hospital that Kakamega residents, for as long as you are registered with NHIF, you simply walk in with your NHIF card, you get the treatment, and you go. We shall not charge you any extra coin for Kakamega residents. For those who are not registered with NHIF, then there is a fee that we have already mentioned, and we really want to encourage Kakamega residents to register with NHIF, because once you register with NHIF, we are going to offer you free service without any co-payment. And I think that is a very important statement that I'm making, so that those who are registered are able to come and get the service. I also want to add that for those who are registered, you are able to get other services other than just consultation. And I think I will leave it at that, hoping that if there are any questions that you may want to ask, then we can pick up from there.
So ideally, our facility was started to treat cancer. It's an advanced cancer center, but over the years we have diversified into other fields, and as Daktari has mentioned, we are treating all other ailments. So Daktari will briefly give us an explanation on how you can know that you are suffering from cancer, when you should do screening, and when you should be worried, and at what stage will cancer be able to be treated, and at what stage do we term that this cancer is now beyond treatment. Now Daktari will give us more insight about the same.
Thank you very much, Patricia. I would like to start off by saying that cancer is a disease that affects all parts of the body as long as it is living tissue. So the only part of the body that cannot develop cancer is the hair and the nails. All other tissues cannot be affected by cancer. Cancer is a disease that multiplies within the body, and it keeps on spreading out. And the most important thing in the diagnosis of cancer is for the listener to check and examine himself or herself, and if there is any abnormal feeling or abnormal swelling in any part of the body, that is a reason for you to go for screening. Cancer is the best treated when it's in its early stages, and that's why I am emphasizing on the fact that anybody who feels any strange swelling or abnormal any abnormality within the body, then that is reason for somebody to go for screening. There are many people who come late because they have been buying painkillers, they have been ignoring some swellings on the body, they have been having abnormal bleeding, and yet they just ignore it. So screening is the most important thing in diagnosing cancer. Cancer comes in various stages. There is stage 1, stage 2, stage 3, and stage 4, meaning that it starts at a certain stage, and it starts at stage 1, and if it is not managed at stage 1, it may advance to stage 2, stage 3, and stage 4. I must say, I want now to explain what these stages are all about. Stage 1 is whereby maybe there is a swelling or an abnormality in a particular region of the body. For example, you might have, if it is breast cancer, there is just a swelling in the breast and it has not spread to any other part. If it is just that stage that we arrest the cancer, then it is treatable, because that swelling, when we take a biopsy of that swelling and we confirm that it's cancer, then through surgical procedure, that is through surgery, we can be able to operate and remove that particular type of cancer, if it is from the breast, if it is on the skin, if it is on the hand or on the leg, we can be able to operate and remove it. Then we come to stage 2. That is, somebody has delayed in going to hospital and now the cancer has started spreading. Stage 2 is where the cancer has spread locally, has gone and affected from the original site. It has spread and affected the other structures that are in the neighborhood of that cancer. So that is stage 2. It's only spread to affect the neighboring tissues. Then there is stage 3, where it has spread and is affecting the neighboring lymph nodes, or the tissues that drain off the cancer cells in the neighborhood, that is the lymph nodes. Then stage 4 is where the cancer has spread and is affecting various other organs, like it has spread from the liver to the kidneys, to the brain, to the lungs, all that. So it is best treated when it is in its early stages. Now, the treatment for cancer are also in stages, depending on the stage at which it has been found. We can start with surgery, because when it has not spread, then surgery, just cutting off the part that is affected, is all that is required. However, if it has spread to the neighboring tissues, then there is a treatment we call chemotherapy. Chemotherapy is using medicines to treat first of all, the original site is removed through surgery, and the subsequent cells that remain in the body are burnt by a chemical known as chemotherapy. Then we also have what we call hormonal therapy for cancers that are sensitive to hormone treatment, like prostate cancer, like other types of cancer which are hormonal sensitive. Then we also have what we call radiotherapy. Radiotherapy is a system that we use to burn some cells which may have remained when the surgery was being undertaken. So the cancer the stage at which cancer is found in a patient, that is the stage that will determine the type of treatment that the patient will receive. Stage 4 is the worst stage, and most of the cases that you hear that people have gone abroad to seek for treatment, that is because they have come to hospital when it's too late, and they go out there for chemotherapy and all sorts of things. But for as long as the cancer has spread, it is very difficult to treat it and cure it. We normally say that the best cure is for cancer stage 1 and early stage 2. But once it goes to stage 3 and stage 4, then it becomes very difficult for one to treat that type of cancer. I also would like to add that screening is a very important component of treating cancer. Screening meaning that even if you are well, you just go to hospital and be checked. And this is recommended by the Ministry of Health, that every year, once a year, even if you have lived a normal life, you should be able to go to hospital just for a checkup. And this checkup is known as screening, where all types of bodies, all types of systems within the body are tested. So we have, for example, the respiratory system, we have the gastrointestinal system, we have the genitourinary system, we have different systems. So you just go for a checkup and those systems are examined and you are told that you are well. This, I like comparing it to those who drive vehicles. When you are a driver, you don't drive until when the vehicle stops. You always go for service. And when you go for service, then the vehicle's engine is checked, and if there is any fault during the service, then it can be repaired and the vehicle gets well. That is also applicable to the human body. You just go for a normal checkup, and if anything is found abnormal, then you are treated. And through that examination, we can be able to diagnose early stages of cancer, and therefore the outcome of the results of the treatment is even much better.
So as Dr. had mentioned earlier, our facility was accredited about 3 months ago, and right now patients are able to get treatment using the NHIF cards. So with NHIF, for the normal national scheme, you only pay 500 shillings every month, and after 2 months, your card will be active and you'll be able to use it in any facility. So for our case, if you want to benefit from our outpatient services, you have to choose this facility as your outpatient facility. For inpatient, you can come with your card. If at all you're going to be taken to the ward, you can use your card without necessarily choosing this facility as your outpatient. So for one to be able to choose the facility, right now it is digital, and you can just dial it in your phone, *155#, and then you'll be given options of changing your facility from the facility you are in to this facility, or if you do not have a facility, you can still go through the same process and have this as your outpatient facility. So also under NHIF, it's not only for a certain group, we have different covers for different groups. There is EduAfia for the students, those students who are in secondary schools, public secondary schools. So long as you have your UPI numbers and you're within Butere sub-county, you can be able to get our services, because the students just come in with a letter from the administration, from the school administration, and they'll be able to get treatment. We also have Linda Mama for the pregnant women or expectant mothers. You can use your Linda Mama to get our maternity services, and as Dr. has mentioned, before close of this year, with the expansion that is ongoing, we'll be having so many departments open, maternity being one of them, and so long as the pregnant mothers have the Linda Mama, they'll be able to access our services. So I just urge everyone to get NHIF, because you'll find our services to be more affordable, and this hospital is for everyone. The fact that it's within a community, it is for the community. It is located in the rural areas. It means everyone can have access to our services. So it's not for the rich, it's not for the elite, as Dr. had mentioned. So everyone is welcome here. Our doors are open from Sunday to Sunday. And if you don't have a cover, you come with 1,000 bob for your first visit. And for the subsequent visits, it's only 500.
Now, we also have our future program. In any organization, there is always a vision and there is a mission. We have a vision of, first of all, setting up a center of excellence, and that is the Hamptons Hospital. This is because of the expansion that we are envisaging. We want also to have our presence felt in the Lake Region Economic Bloc. The Lake Region Economic Bloc has 14 counties, meaning that we want to set up satellite facilities in all the 14 Lake Region Economic Bloc units. So our next step is actually going to be setting up another unit in Busia, and the reason why we are setting up other units is because of the catchment that we are trying to look forward to. We are looking at the Ugandan market, and we are hoping that once we have set up this as our center of excellence, then we can set up a center in Busia and put there an ambulance and have a set of staff, basic staff in that particular facility. They will manage minor ailments in that facility, and then if there is any reason that they have to refer the patients to this center, then we shall have patients referred to this center. We also intend to open up centers in Kisumu, which already has several facilities, but as I've said, ours is going to be a unique sort of setup, and we want our presence felt everywhere like it is by the Aga Khan healthcare providers. This is because we have felt the need to spread out and actually reach out to the people. The purpose of devolution was to reach out to the people. We are setting up our centers in the rural areas so that people in the rural areas are not denied health service delivery. And that is the basic reason why we are reaching out to those centers, opening up those centers. Secondly, is that we have heard of so many patients being referred abroad just because of cancer treatment. So our focus has also been, apart from reaching out to people who live in the rural areas, we are also reaching out to people who need to be attended to early, spread out in all the Lake Region Economic Block regions, counties, and we hope that with those two targets in our mind, that is community and the communities and the rural communities and people who need services being spread out to them. That is the reason why we are thinking of this expansion program. The expansion program is something that we look forward to. We have talked about it on Facebook, but it is our vision that we shall eventually reach that stage. We already have had several cases of cancer, and precisely we have had almost 18 cases of cancer. Mostly there are advanced stages of cancer. And when we get these cases, most cancer patients, when they come, we manage them as outpatients. Outpatient because cancer treatment doesn't require hospitalization if at all somebody is mobile. They just come and we give them their injection of cancer treatment, and then they go away. Normally it is from day 1 to day 7. They take a break, again they go away, come back from day 1 to day 7. So there are several cycles of treatment that these patients normally undergo. So most cases that we have encountered here are patients who come treated and then they go home and come back for subsequent treatment as outpatient. We only have referred 3 patients to other facilities because they required inpatient services, which is very rare, especially when they come in with all types of complications and several organs are affected. And when that happens, of course, we are also conscious of the fact that we are not able to treat all cases, and therefore, if necessary, we have been able so far to refer only 3 patients, but all the other patients have been coming, we give them their shot of treatment, and they go.
For our corporate social responsibility, that is CSR, we are coming up with a program of sponsoring the people in the community. That is for the benefit of people who come from around the environs of the hospital. And we have identified around 200 families that is the most needy and vulnerable in the community to sponsor them for the NHIF cover so that they are able to benefit from our services, so that they don't see that this is beyond them. And then that program will be rolled out from 1st of August, and hopefully we'll be able to help the community to benefit from our services. Aside from that, we also offer health talks to the secondary schools around to just empower them and have them educated on various health issues, and to have them know that there is a hospital somewhere in the environs that cares about them. For the girls, we give them free sanitary towels, and as schools reopen, we are planning to continue with those programs for the benefit of the community. For more inquiries, you can call 0723 150 154. The line is always open, and if you have any questions about our treatment, you can always call and you will get answers. And also you can send us an email at info@hamptonshospital.com, and you can follow us on our social media handles, that is Mwale Medical and Technology City on Facebook and MMTC Kenya on Instagram. You will get updates of every development that will be ongoing at our facility.